Well, welcome back everybody to our online program on the stigma of the addiction. So we've talked a bit about the public stereotypes of the addiction. We've talked about how the addiction affects people who are suffering from substance disorders. And this third one now, it's kind of interesting, is that the healthcare profession, the research is now clear that the stigma has sort of infused throughout the healthcare system. And again, not 100% or anything like that, but still very, very powerful. And one study showed that even in a pretty major clinic, very professional, very licensed and everything else, that the stigma is very powerful. What happened is the clients having some behavioral problems, basically being a pain, things like that, not being entirely honest. And a researcher basically stayed in the clinic for 8 to 9 months and just watching the interaction with staff and clients and realized that what was actually going on was the staff attitudes towards the clients, who were very condescending. They didn't think that clients are really serious about getting better. And they thought, really they're just using the system and wasting tax dollars and, that kind of attitude, right? And they realized that this is actually what was causing all the behavioral problems at the clinic. It was the attitude of the staff who were stigmatizing the clients. And we see this quite a bit. Those, for example, who drop out of treatment are very often sort of forced to justify themselves, right? Against charges, for example, that they're wasting tax dollars or cheating the system. The stigma is also why it's okay to coerce clients into, even after they've been discharged, into doing things. The most famous example the researchers bring out is drug testing. And most of us think, well, drug testing may be done like for an employer or maybe the police or something, but it actually happens a lot in the families. A lot of the families will only agree, for example, for their loved one to live in the home if they are drug tested once every week or once every 2 weeks. In other words, which is quite a coercive thing, right? But this is all completely acceptable under the argument that, of course, you can't trust them. They're overwhelmed by the addiction. All the typical things that are part of the stigma of addiction. So even in healthcare, right, which is kind of curious, where everyone's trained to treat it as a health issue, even the stigma is creating all sorts of problems in people. And by the way, when people with drug problems want to enter into the healthcare system, they're fully aware of this. So there's no mystery anywhere. And so you can see that you might start hesitating and delay treatment or delay telling your doctor about this. So this is another problem with the stigma. It's creating these barriers that for people to just be open about what their health problems are. Anyway, that's it for this version of our online program, and we'll be back next time with another topic.